So hi guys, welcome back to Simply Fujica. Guys, as you can see, we're not having our typical intro, and we most likely will not have our typical outro. Summer is in full swing over here, and so we're kind of making it do, right? But I did want to keep my promise to you guys, which is the two-part series, which is now 3, and I'll get into that in a minute. But really just kind of debunking Medicare, debunking Medicaid. How do we start having access to those clients who need our services, and those services are covered by those insurances? So if you recall in that first video, we really spent a lot of time defining both programs and talking about those eligibility requirements, both on the client side, and then what does that eligibility part look like for us as providers. So today I want to take you through how do you properly apply to become providers for those programs. And then as I was doing research for today's video, I actually discovered there are additional options to try to have, to assist the clients in covering their services. So I'm actually turning this from a 2-part into a 3-part, only because it is so important and because a lot of you are asking me about it. So with that, guys, I'm going to transition into today's video. So hopefully you guys can see my screen. And actually, if you see, this is the first website. This is one of 2 websites we're going to visit today. So this cms.gov is the actual Centers for Medicare and Medicaid Services. I'm actually going to go ahead and ensure that that website link is included in the description of the video so that you guys can have it. But as you can see, what I did is I just came to the part that if you look on kind of like on the side, if you will, there's, well, actually, if you look here, here are the cookies here. So I just went to home, went to the Medicare portion of it, provider enrollment and certification, and then, of course, Medicare enrollment guide for institutional providers. And guys, it actually says up here, you want to use this guide if you are enrolling a hospital, critical care facility, skilled nursing facility, or a lot of us will fall under here, home health agency, hospice, or other similar institutions. Okay. So there's an actual guide to kind of help us make heads or tails of this actual process. And so the first thing that we need to do, guys, is make sure that we have an MPI number, okay? So MPIs are issued through the National Plan and Provider Enumeration Services, but you can actually apply for the MPI on the website, okay? And so I just went ahead and clicked on it real quick so we could take a look at it. It's going to make sure that you're, make sure you understand that you are entering a government website. And so you can go ahead and create an account here and then get some more info, or if you're returning, you can sign back in. To learn more about how to apply, you can just go ahead and click there. So as you can see, it's very, I would say, user-friendly because it's kind of step ticks all the way through. And so what I love about this is it is a 45-page guide. Nevertheless, it is a guide. So that you do have the information to kind of walk through. But you do need that MPI number. I just want to be honest. You're not going to get too far without that MPI number. So step 2 was to complete the Medicare enrollment application. And as you can see, guys, in this second step, it says enroll using PACOS. Now, PACOS is the online Medicare enrollment management system. So this is in order for you, this is how you manage your enrollment. So let's say you want to know what step of the process you're in. This is the system that you would use in order to get that information. We clicked into the Medicare enrollment portion of the website, and as you can see, if you're returning, you can just go ahead and log in, or at this point, you can go ahead and register for a user account. Now, one thing that I did, want to kind of talk about here is there is an enrollment checklist. You guys know how I love my checklist, and I actually already clicked onto that just so that I can kind of go over this with you guys. But it lets you know what are some of the things that you need in order to complete the enrollment on the PACOS system. So this is something definitely that you can download. You can create it as a PDF file. But again, this is just making sure that you have all of this information prior to you filling out that application. So I thought that was worthy of us talking about. Of course, definitely the third step here is to pay the Medicare application fee. The Medicare application fee for 2022 is $631. And then they actually have a direct link for you to go into so that you can take care of that payment once you're ready. Now, again, you want to make sure you have these previous steps taken care of before you pay it. Now, in terms of step 4, it reminds me of when you're applying for your home care organization license. Once you submit that application, you're not alone. Typically, with a home care organization, you're assigned a specialist. In this particular situation, you are to work with your MAC and the state agency. So Medicare Administrative Contractors, or MACs, process all Medicare applications, okay? So once you actually submit your enrollment, these are the people that are able to assist you with your pending application. And there's another link here, contact your CMS depending on your location so that you have that contact information, okay? So very good stuff here. If you need, again, if you need help with your enrollment, here's where you can contact your specific MAC here. Okay, so good stuff for you guys. And I'll just take a look at that really quickly since we're on the line about it. But this is your pretty much your contact list, and it actually is broken down by state. Okay, so this is helpful for our folks that are not, necessarily in California, which is where I am. Okay, so good information there. Again, hopefully this is a value add. Now, the one thing that I will say to you guys before we jump over on the other side of the house is that as I was doing research for this video, there are a whole bunch of, when you pull up Medicare, when you pull up Medicaid, there's so many, subtopics that come up. There's so many different sites that come up. You want to make sure that you're not going to a third-party servicer. And the reason why I say that is because that is going to entail a fee. So these are folks who just like I have worked to get the information. And of course, they will fill out that information for you and kind of get you going, of course, at a fee. But I like to do videos like this because as easy as I brought this up, you certainly will have this video to use at your, at your will. Whenever you have time, you can always pull up this video, stop it, start it at the certain spot so that you can do it yourself. I'm definitely not saying that there's anything wrong with you hiring a third party to take care of this for you. I just like to, whenever I can, promote people being resourceful so that we can, spread out our coins whenever we can. Okay, so hopefully that has been a value add, you guys. That is the Medicare portion. And so right now we're going to flip on to the other side, which is the Medicare. The one thing that I wanted to dispel up front is Medi-Cal is California's Medicaid healthcare program. So sometimes you kind of hear those things interchange and it might be a little confusing. So I wanted to make sure that I kind of started off this section by pointing that out. Okay guys, so I did want to go ahead and welcome you to now the Medi-Cal portion of this video. And again, I will make sure that this portion is, the website here is actually included in the description of the video, just so that you can have it. But when you initially come into medical.california.gov, you can kind of see it says, welcome to the Medi-Cal Provider home. This is where you want to be. This is how you know that you're in good standings, okay? This is how you know you're in the right place. And so, of course, because you're trying to become a provider, this is where you want to go. And as you guys can see, it's the very first thing. Are you trying to enroll or re-enroll as a Medi-Cal provider? And in this case, guys, we want to enroll. And I don't know, there may be some of you out there that are re-enrolling. This page is very information rich. So as you can see, there's information here about provider enrollment, PAVE. PAVE is the secure web-based provider portal. So that really is the portal that you will be using throughout the enrollment process. There's some applications, instructions, and requirements, some statutes, and of course, there's some resources. So again, very information heavy, but I love that. And so really on this page, where we want to go is we either want to access PAVE, or you could even click this link here. because this is the streamlined. So PAVE is the streamlined provider application process. So what I love about this, again, another information rich section of the website, because you can either just go ahead and get started now, or they have training videos, they've got webinars, they've got Q&As. So a lot of information here. There's related pages here just in case. There are provider types. A lot of information for you guys in order to help you get approved to become providers. And again, this is something that's important to a lot of us. I know, especially for the California, for those of you who are going through this process in California, a lot of our clients do carry one or both of these programs. And so they, of course, are interested in getting services. And this is the way that they're going to cover those services. And so it would really, even though I know we're kind of start racking up the fees because everything is fee based, right? But when you think of that return and when you actually start getting clients in, then this is definitely something that would be beneficial to you. So again, wanted to make sure that we went over both programs. Definitely go ahead and visit, and I'll have it linked up here. Go ahead and visit my initial video, which was again, understanding Medicare and Medicaid. I will make sure that's an information card at the top, and I'll make sure it's included in the bottom. And then again, next week we will conclude this series on talking about other methods in addition to Medicaid and Medicare, and of course cash. We've talked about that already. So hopefully, guys, this was good information for you guys. I wanted to make sure that you guys see that really we are living in an age that everything, we have so much information available to us. And although it may take some time to go through all of the layers of information that's available to us, I really hope that doesn't deter you, but it really encourages you to break through some of those layers. Now, so for different questions that I had, remember, there's always 800 numbers. There's always people you can just get general information. So don't be afraid to do that either. If you're not sure, rather than get your, application kicked back, or, hold up that app or stall that application process, reach out to your resources. Those 800 numbers are resources. So again, there's always, there's a contact us on almost every page. There's where you can email questions, things of that nature. So really make sure that you're up for kind of getting in there and getting that information that you need in order to put your home care agency in a light where you can accept these type of clients. So again, I hope this is what you guys were looking for. It is still June, so I am still accepting topics because in the month of July, we'll be going live for 10 days. 10 days live is what I'm calling it. So if you have any topics, make sure you enter them into the comment section. For 10 lucky people, I will be sending them Starbucks cards for $5 if I select your topic for my 10-day live sessions. Okay, so guys, that's all I have for you today, guys. Stay blessed.